have the normal anatomy of the heart, where we see a complete septum that divides the right ventricle from the left ventricle. For abnormal, we have the septum that has a hole. So the right ventricle is not completely separated from the left ventricle, which causes blood flow in between.
So the blood flow and oxygenation issue with VSD is when there's a hole between the left and right ventricles, and the blood from the left ventricle is going back into the right ventricle instead of out of the heart through the aorta. When this happens, there's too much blood getting backed up, and it's getting backed up into the lungs.
Okay, so manifestations of ventricular septal defect is increased pulmonary infections, decreased growth, problems feeding, and failure to thrive. If the defect is small, it can be asymptomatic. If it is large, a systolic murmur is audible at the third and fourth intercostal space at the sternal border. Backup in blood flow results in pulmonary hypertension, tachypnea, dyspnea, and of course they are failure to thrive.
Diagnosed with ventricular septal defect, there are multiple treatments that can be in place. The majority close within the first 6 months of life when they don't have like large side effects from it, but then they also can prescribe medications and, if indicated, surgery. Medications that are prescribed can be diuretics like furosemide, which will reduce preload and reduce blood volume, digoxin, which is a glycoside which increases cardiac output and decreases heart rate, or an ACE inhibitor, which causes vasodilation and decreases the blood volume, which also reduces preload. And these just make it easier for the heart to function and decrease workload. And then surgery is indicated if it does not correct itself and the infant has failure to thrive and does not grow.
Major complications of VSD include heart failure, pulmonary hypertension, endocarditis, which is an infection of the heart, and poor perfusion to the rest of your body.